The information provided in the Golden Nuggets health and wellness shows, including but not limited to advice, tips, and discussions on mental, physical, and spiritual well-being, is intended for general information purposes only. It is not a substitute for professional advice or treatment. The Golden Nuggets health and wellness shows are designed to inspire and inform, promoting a holistic approach to health for the mind, body, and soul. However, individual circumstances vary, and what works for one person may not be suitable for another. Before making any significant changes to your lifestyle, diet, exercise routine, or adopting new practices discussed on the show, it is strongly recommended that you consult with qualified healthcare professionals, nutritionists, or other relevant experts. They can provide personalized advice based on your specific needs, health status, and any existing medical conditions. The host, guest, and producers of the Golden Nuggets health and wellness shows do not assume responsibility for any consequences arising from the use or misuse of the information provided. Viewers and listeners are encouraged to use their discretion and take responsibility for their own health choices. By engaging with the Golden Nuggets health and wellness shows, you acknowledge that the content is not a substitute for professional advice and that you will seek the guidance of qualified professionals when needed. Thank you for being a part of the health and wellness community.
Welcome to Golden Nuggets Health and Wellness Show, the television program that's redefining self-care for the mind, body, and soul. My name is Dr. Elect Starr. I'm a licensed mental health counselor, health and wellness consultant, and your host for this show. Our mission is simple: to empower you with creative and innovative self-care strategies that help you prosper and be in good health even as your soul prospers. In our first series entitled Compassion Fatigue, The Cost of Caring, we dive into the emotional and physical exhaustion experienced by helping professionals. We explore what compassion fatigue is, who's at risk, its signs and symptoms, and most importantly, the steps to address and prevent it. Today, we focus on healthcare professionals and compassion fatigue. But before we begin, allow me to introduce our guests. Janice Akers-Rhinehart. She's an RN, and we are so glad to have you.
Thank you. I'm glad to be here with you.
The honor is ours. Would you tell us a little bit about you and what you do?
I certainly will. Again, my name is Janice Akers-Rhinehart. I am a registered nurse. The way I sort of came this way, when I started school and graduated from high school, I was sort of torn in between pursuing medical technology or going into nursing. And my aunt at the time said, you can always come back to nursing. So I did medical technology for many years, and I went back to school for my nursing degree. And so I currently work as a nurse home visitor. It's like a public health nurse where I visit pregnant clients or first-time pregnant moms. I visit them weekly in their homes, trying to support them, provide them resources, and the impetus was to sort of help prevent the infant mortality rate that is so high, especially here in Indiana during this time.
Wow, what an awesome job. Thank you for your service.
My
I'm so
pleasure.
grateful for what you do to make a difference in the lives of so many people.
That's the goal. That is the goal.
Yes. Well, today we're going to talk about self-care plan for healthcare professionals. We're going to talk about how compassion fatigue impacts healthcare professionals. Now, we've talked about in the earlier show, we were privileged to have Janice with us, and we defined what compassion fatigue was, and we also shared who are those folks who are at risk for experiencing compassion fatigue. And we also identified signs, those warning signs of compassion fatigue. So it was wonderful. And today we're going to focus on the self-care plan. But before we get into that self-care plan, I want to look at how it impacts healthcare professionals. How does compassion fatigue impact healthcare professionals. So before I begin, I'm going to allow Janice just to share her thoughts on that before I share mine. Is that okay with you?
That's fine, that's fine. And when you say that, what immediately came to my mind is, certainly nurses experience it, caretakers, social workers, et cetera. But I think about the physicians that really, really struggle with it, and they sort of being at the head of the food chain, for lack of a better word. They really get it front and center. And so even them being able to, experience and activate self-care within their own lives, knowing when to, because some patients can be extremely challenging, can be very demanding, and I'm not trying to knock patients, because they've got things going on with them.
Absolutely.
And so they push that off onto that doctor and expect him to work miracles when he is not a miracle worker, but they receive the brunt of that. But I think that they really, really need to be aware of and begin to access, self-care so that they can genuinely do, and this is my point I was trying to get to, even knowing when they cannot no longer really genuinely help this patient, and although this patient is still pushing them, to say, you probably would do better with another physician, and just sort of maybe reposition them with someone else.
That's excellent, because I'm thinking as mental health therapists, we are also responsible for recognizing our limitations and referring. Mm-hmm. Yes, and we stay within our scope of training.
Correct.
So I could relate to that. So Janice, what I'd like to do now is just talk about the impact of compassion fatigue on the healthcare professionals. And so I have several things here, and I want to share them, and you can chime in anytime if you want to add something to it, comment. But the first is reduced empathy. It's hard to imagine that a healthcare professional would decrease in their capacity to be compassionate and caring when, after all, isn't that what you've been trained to do? But compassion fatigue is a phenomenon that takes place when you are overwhelmed and you are caring, and it's an ongoing, prolonged, and you're not taking time to rest, right?
Correct.
Do those things that we talked about earlier. So reduced empathy is an impact. Burnout. So we know that burnout and compassion fatigue are two different things, right? So burnt out refers to the workplace, the environment, your work hours, your caseload, the demand that is placed on you. But compassion fatigue can impact that as well. So we want to keep that in mind. It can cause, for example, the physical, emotional exhaustion. So if you are mentally, physically, emotionally exhausted, do you see that impacting your job, right?
Absolutely.
What about increased absenteeism? That's a symptom, so it impacts the job. And then people leave, they get burnt out and they just leave the profession.
Right.
Not recognizing that what they're experiencing are symptoms of compassion fatigue. In some cases, not every case, of course. Decrease in job satisfaction. That's another one of those dynamics that occur. Impaired in the decision-making process. So if you think about compassion fatigue, we said earlier, inability to focus.
Yes.
And then if you're irritable, frustrated or angry, those emotions can sort of take charge, take the wheel,
That's true.
and guide you in your decision-making process. Mental health issues also can affect our healthcare professionals. They can struggle with depression, anxiety, post-traumatic stress disorder. And oftentimes if they're not careful, they can turn to unhealthy coping mechanisms such as substance abuse.
Correct.
I want to pause and just reflect on these before I go any further. So we're saying reduced empathy, burnout, decrease in job satisfaction, impaired decision-making, and mental health issues. What are your thoughts on this impact of compassion fatigue? You see how serious compassion fatigue is?
Absolutely, and which one really stood out to me when you were talking is that reduced empathy, because remember, we went into this healthcare field, because we care for people, and you find yourself not caring the way that you used to. And so it becomes more of just completing the task as opposed to actually caring for the patient or the client in my particular case. And so you can sort of lose yourself in that, but I think it's important for not only you to recognize it, but even those that are over you, you know, your supervisors, your managers, et cetera, to be aware of it and be working on it and trying to help you and make sure that you have the support that you need, because ultimately it's going to cost them if they have to retrain someone because you just walk away just because of what you're experiencing or no longer enjoying what you used to enjoy doing. And so for those managers or those supervisors to catch that, or let me even bring it a little closer, even for your friends, your family, to say, hey, you don't seem to have that joy like you used to have, just to sort of catch that and begin to sort of revisit that and see, why am I feeling like this? Why don't I care anymore? What is going on? And just try to get to the root of the cause of what's going on.
Yes, I like that. So we have a responsibility to one another.
Yeah, we
our
do.
colleagues to look after one another. Absolutely. And of course, to be aware of those signs and symptoms, right? Because how can you support your colleague if you don't even recognize the signs and symptoms? And that's why we're here today, to bring understanding to this phenomenon. Very good. And as we continue to talk about the impact of compassion fatigue on our professional healthcare workers, we also have physical health issues, such as headaches, sleep disturbance, increase of even chronic disease. Wow. Who would ever think that compassion fatigue can cause physical problems? Strained interpersonal relationships. We touched on that a little earlier. Increased turnover, which you just discussed, and lower patient satisfaction. You said that also. Wow. And ethical dilemmas. Before I go any further, what are your thoughts on the physical health issues, strained interpersonal relationships, increased turnover, lower patient satisfaction, and ethical dilemmas?
So I think the one, again, that stands out to me is essentially that physical toll that you're taking on by that whole compassion fatigue situation. I think, the way that our bodies are physiologically constructed, if things that are impacting us is going to go inside before it actually comes on the outside. And so we sort of experience that, and I think about the way that cortisol, you begin to maybe gain weight because your cortisol balance is off, and just so many things can happen physiologically just because you're struggling emotionally or mentally. But then again, I have to go back to what we were saying earlier about, to a certain degree, I am my brother's keeper. So even me just reaching out, or if I'm seeing someone that's struggling, say, girl, are you okay? Or what's going on? What can I do to support you? Where can I direct you? Can we have coffee? Can we just talk? Can we just have a conversation? And so then too, I think that even can be helpful, even as a tool to sort of reach some that are struggling with it.
Absolutely. Thank you so much for sharing that. I had so many thoughts going on in my head as you were talking that you brought up for me. We're going to pause for a break, but I do think, and I want to just emphasize that it is important for healthcare professionals to recognize those signs and symptoms, to be aware of them, to understand the impact as well. And it's okay to ask for help. And it's okay to tell your friend, your colleague, out of a heart of concern, hey, I think you need to get some help, or I think you need a vacation. Or let's talk about what's going on in your world. That's absolutely important. So we're going to take a break, and we'll come back, and we're going to look at strategies, those golden nuggets to reduce the symptoms of compassion fatigue. So come back. Thank you for joining us.
Dr. Starr, best-selling author of Golden Nuggets, Food for the Mind, Body, and Soul, is also a health and wellness speaker and consultant who provides motivational speaking, training conferences, and one-on-one coaching to improve the quality of life. She's passionate about helping people heal from the inside out. Dr. Starr provides creative and innovative self-care strategies that empower you to prosper and be in good health, even as your soul prospers. Call or visit the Golden Nuggets website today. Feeling anxious? Perhaps you're dealing with a past trauma and don't know where to turn for help. Turn to Unlimited Possibilities. We provide a safe and caring space for individuals and families to help improve the quality of their lives. Whether you need help with spiritual matters, trauma, depression, and more, Unlimited Possibilities can help you overcome your situation with compassion, acceptance, respect, and empowerment. Unlimited Possibilities, where all things are possible if you believe. Call or visit our website today.
Welcome back to Golden Nuggets Health and Wellness Show, food for the mind, body, and soul. For those of you just tuning in, I'm Dr. Starr, licensed mental health counselor, health and wellness consultant, and your host for this show. We're talking about compassion fatigue, the cost of caring. Our focus today is healthcare professionals and compassion fatigue. Our esteemed guest is Janice Akers-Rhinehart, and she's an RN, and we're so delighted to have her. Thank you for coming to be with us today.
Thank you for the invite. I appreciate it.
It's been wonderful, wonderful sharing. We are talking about a self-care plan for this portion of our program. So what is a self-care plan? A plan is where you put together things that are going to work for you, for your lifestyle, for your daily activity. You just incorporate it. It's a plan of strategies, things that I am going to do. Certain time of the day, certain day of the week, but it's a plan. It can be written in your phone, it can be written in your journal, but the main thing is you have a plan, because if you fail to plan, you plan to fail. So we're going to talk about these golden nuggets. So what can we do? We've talked about what compassion fatigue is. We've talked about those at risk. We've identified those warning signs of compassion fatigue. We've even talked about the impact, how it impacts our helping professionals. So what comes next, of course, a plan. A plan to reduce those strategies. A plan to prosper, be in good health, even as your soul prospers. So I'm going to identify some strategies here. I have quite a few. And I want you to share any thoughts about any of these strategies, any comments, but I think it's good stuff here.
Okay.
And we know that everybody's plan looks different,
Yes.
right? It's individualized, it's personalized. So we're just giving recommendations, that's all. We're just sharing nuggets for you to consider. So let's start with prioritizing sleep. Now, the recommendations are 7 to 9 hours, and I do know that some people don't require 9 hours. I know I don't. I like to sleep, but my body says, get up. So I don't need, obviously, 9 hours of sleep, right? But that's the recommendation, and to have a bedtime routine. I tell my clients, if you're preparing to go to bed, then what do you do when you have a baby? How do you get that baby to go to sleep? And they'll go, so I bathe the baby, I feed the baby, I might sing a lullaby, I might rub the tummy or the head. I'm like, exactly, because you want what? I want that baby to sleep during the night, right? So I say, well then, what about doing that for you? What prepares you for bedtime? What helps you to unwind and get ready to sleep through the night? So another recommendation here is avoiding caffeine. I had a client who struggled with going to sleep, and just removing the cookies did the job. They had no idea that cookies were keeping them from falling asleep. Something as simple as that. So prioritizing sleep is the number one strategy. Number 2, maintain a healthy diet.
Yes.
That's important, right?
Yes.
Eat a healthy diet with plenty of fruit, vegetables, lean proteins, Stay hydrated throughout the day and avoid excessive, again, caffeine and sugar. And of course, we know that you always follow your doctor's recommendations, right?
That's true.
Because this is personalized, remember? So you want to follow your doctor's orders above all. Exercising regularly. Now that looks different for everyone as well, doesn't it?
It does.
You see, so we want to emphasize this is personalized. You have to create a plan that works for you. But incorporating, the recommendation is at least 30 minutes of physical activities into your daily routine. And find activities that you enjoy.
Yes.
That is important, isn't it?
It is.
The next, number 4, is stress management. Relaxation techniques is something that we could practice, and there's different kinds. Deep breathing, meditation, mindfulness. There's progressive muscle relaxation techniques. We could go on and on. Listening to music. What about laughter? Oh my goodness, laughter is like medicine, isn't it?
It is.
And just something simple as singing. I remember when I first discovered that singing was a relaxation technique, I thought, that's easy, because I love to sing. But just singing, because you're breathing deeply, right? So learning to relax, laugh, 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 and laugh some more will help to reduce that stress. Setting boundaries, we've talked about that. I don't think we can ever say too much on setting those boundaries. Establishing clear work-life boundaries to prevent overworking.
Yes.
And learn to say no when necessary to protect your personal time. So before I go on, because as I said, I have several, I want to just kind of get your thoughts on prioritizing your sleep, maintaining a healthy diet, exercising regularly, stress management, and setting boundaries. Any thoughts on those 5 before we continue our list of golden nuggets?
And certainly I love all 5 of those. And what stands out to me is, and this is my own personal coping mechanism, even when I am stressed or things are going on, I like to walk. So I will go walking. I will go walking, especially if it's nice outside, and I'll find myself just walking further than I had intended to walk. And even just being out in nature, it seems to be very, very helpful. And especially in the summertime or in the spring, or even sometimes in the wintertime when it's not too brisk outside, just to be outside and just to be a part of nature, I think is very, very helpful. And certainly, you know, making sure you're having a balanced diet, getting the rest that you need, and there again, just taking care of you.
Absolutely.
Taking care of you. So I think that's great. Those 5 things that you mentioned, excellent, excellent.
Yes, you made me think about one day I was driving down the street, and this was in the winter, and I saw an older couple. And they had gone to Starbucks, and they were just walking, holding hands, drinking coffee. And I thought that was so sweet, you know? So there are different ways to relax and breathe, take time out for you, right? Thank you for that.
Right.
So we're moving on. Number 6, take breaks. Take breaks. Utilize your breaks at work for relaxation and rejuvenation. Step outside, stretch, engage in a short mindfulness exercise. One of my favorites is just closing your eyes and just picturing the beach and see the sunset, the beautiful sunset, or the sunrise, and see the waves just moving and the birds flying over the ocean, the waves, and it's so relaxing just thinking about that right now. But that's imagery. So that's another example of a short break. Just picturing yourself, or at your favorite spot, whatever that relaxation place is for you.
Right.
Just seeing yourself there. You will be amazed what the mind will do. The mind doesn't know that you're not physically there.
Right.
And so it responds as if you are there. I love that. Number 7, seek social support.
Yes.
So important. Connect with friends, family, colleagues for emotional support. Share your feelings and experiences with trusted individuals. It's so wonderful to have people that you can call up and say, hey, can we have lunch? Can we have coffee? I just need to talk. And to know that they care.
Yes.
That is so important. Everybody needs somebody, right? Would you agree?
I totally agree.
Everybody
Excellent
needs
strategy.
somebody. We were not created to live in isolation. We are social beings. And so just finding someone that you can talk to and express your feelings is absolutely a nugget. Would you agree? Nugget.
I would agree, and I would even throw this out too. If you think about even in creation, you know, everything that God said he created, it was good, but the only thing that he said was not good, it was not good for man to be alone.
Wow.
And I think that continues even to this day. It's not good for man to be alone. We need that social network. We need to be able to connect with someone.
And what do you say to people who say, I'm an introvert and I don't like being around a lot of people, they drain me? What do you think about? How do they have their needs met if they're an introvert and they say being around people drains them?
And actually, my husband and I, we have 6 children, and 4 of them are introverts, where the other 2, they're just extra. But extra. They are very extra. But what they do is that they'll, especially my one daughter, she'll say, you know, she'll dip into it. So in other words, she'll socialize and it's like, okay, I've met my limit. So she will do that, and she knows that she does need to do that. And so does my son. He knows that they do need to do it. So they'll dip into it, but they're not trying to live there. So I would encourage people to please dip into being social, and you can come back and be yourself when you get ready to. But she'll say, okay, I met my limit for the day. So meet your limit.
All right. And now one more question. What about the empaths? Now, empaths will tell you, I go around people and I just absorb too much of their energy and it's overloading me. I can't handle it. I just sense so much. What do you say to empaths?
And, you know, I guess I would say to them, you know, once you have absorbed that and you experience that, come talk to me. You know, come on and release it to me, and then you can go back and be yourself again.
Very good, very good. Because we do have those situations that are real. Mm-hmm. Absolutely. Mm-hmm. Number 8 is professional support. That's important.
It is.
And not to feel shame.
Right.
You're not a bad person if you're struggling with depression.
Right.
Or anxiety. There's, I have people that think, well, what is wrong with me? Have you ever heard that?
Yes.
What's wrong with me? And my thing is, there's nothing wrong. Mm-hmm. You're human. You are. And you're impacted by the work that you do. So get the help and the support that you deserve.
Well, there you go.
There you go. Yes, mm-hmm. Absolutely.
Deserve.
Number 9, continuing education. That's important, to stay updated with the latest developments in your field to boost your confidence and competence. Attend workshops and conferences whenever possible. And hobbies, interests are important as well. Doing fun things, being creative. Do something that makes you laugh. Do something that's relaxing. Do something that's fun, right?
Yes.
All of these are wonderful self-care nuggets. Time management is important. Organization, keeping the clutter, the chaos out of your world.
Right.
Regular checkups.
Very good.
Is important as well.
Very good, yes.
Seeing your doctor, taking care of yourself is important. Stay on top of your health. These are all wonderful nuggets. Any closing thoughts as we wrap it up?
I would say that just doing the things, and you stress that, doing things that you enjoy doing and doing them daily, and even not being compelled to do things that other people feel like you need to do, whether it's in your job or other things that you're involved in where you feel compelled. And I'll say this, I can't live up to people's expectations of me, and so not trying to live up to others' expectations, but be you.
Absolutely.
Be you.
And our time is up. We've had a great time today. Thank you for joining us. And Janice, thank you for your sharing. This has been wonderful. It's been a pleasure, and we want you to tune in for our next show. We have exciting things. So until then, may you prosper, be in good health, even as your soul prospers. Bye for now.